I'm Bob Goldberg. I'm Vice President of the University of Oregon and Executive Director of the Phil and Penny Knight for Accelerating Scientific Impact. My role here is really to set the vision for the campus, to hire amazing faculty like Tim Gardner, and to do research. I'm still an active researcher, so my research is in musculoskeletal mechanobiology and regenerative medicine, and I work on degenerative conditions like osteoarthritis as well as injuries to bone, muscle, and cartilage.
Hi, my name's Tim Gardner. I'm an associate professor here in the Knight campus, and my research area is neural engineering and sensory motor learning, and so we focus on how humans and animals learn to perform motor actions and how the brain supports that learning process. And as part of that, we build devices that improve our ability to record from the brain and to control the activity of the brain in the study of that. Prior to the Knight campus, I was working as a faculty for a number of years at Boston University in the biology and biomedical engineering departments there. And then in the 2.5 years immediately preceding the Knight campus, I was working in a startup company called Neuralink in the Bay Area in San Francisco.
I often say that Tim is sort of the prototype Knight campus faculty member because he is at the same time an amazing academician and scientist in academia who's NIH funded, but also has taken that work from discovery in the lab all the way through to startup companies and working even with Elon Musk and Neuralink. And you know, to toot his horn, because he won't do it, he was really studying something very fundamental in birds, which is how they learn and how they adapt, and had invented technologies to be able to image that in real time in the birds, and then was able to take that concept and transfer it to, well, what does that mean in humans? And that's really where the startup companies came. So yeah, my own experience with startup companies started when I was a student. When I was a graduate student at the University of Michigan, we were working on how to make models of really complex structures in bone as a way of understanding osteoporosis and why do elderly people have fractures, and the changes in the structure as they age and when are they at risk for fracture. And it turns out, as an engineer, to make a model of something that was really complex like that was difficult, very time intensive, took forever to sit down at a computer and draw out all the surfaces and make the model. And so we invented a way, we being myself and one of my advisors, a way to make those models directly from images. And so you could take three-dimensional images that had that structure and actually had the density of the bone and convert it automatically into a model. So something that took months to make for a student sitting down doing it on a computer, we could generate a model in a matter of just a few minutes. And so that became a company, and it turned out actually the major application for that was in the automotive industry, where they would image parts coming off the line, and instead of having to tear down every 100 part, they would take an image, make a model, and just go on from there. And so it saved them a lot of money.
Very interesting. I was a student in physics at Princeton originally in my first training, and I would say in that era and in that environment, high energy physics was really the gold standard in that physics department, and I think was really raised thinking that working with industry was the least interesting option for students to move into, and really, for most of my career as a postdoc and as a assistant professor, just focused on basic research. But I realized that we were very much held back by the tools, as you said. The things that we wanted to do, we couldn't do without better instruments, better tools, and that really drove me to build devices that could better record from the brain and better interact with the brain. And I think as I went down that path, I just realized how difficult it was to do that without a team and without the resources that you really needed in a larger setting. And so I think for me, probably what was transformational was an experience of collaborating with GlaxoSmithKline. They had a industry-sponsored research program at the early days of a new initiative called Bioelectronic Medicine, and I really loved what the company did in that period. They brought together 20 or 30 different labs from around the world that could contribute either technically or in basic biology to ask this new question of whether or not you could treat disease by modulating nerves. And was just really fortunate to get involved with them. It grew out of just sending an email to a website saying, hey, this is what I do and I'm interested. And then someone came and visited and ended up being a funded project that lasted for a couple, 2-3 years. But the best part of it was they brought together these people to conferences every 2 or 3 times a year and just very free exchange of information and brainstorming about what might be possible. And I saw, I think, really the scale of what could be done with industry collaborations. And this level of communication, level of interaction was just really exciting, I think, and made me, I think, hungry to be involved in that level with industry. So I was primed to say yes when I had an opportunity later to do the same. And that was maybe 2 years later. I was on sabbatical from Boston University and got a phone call to visit a friend in San Francisco and met some people there who told me about the beginnings of a conversation around a company, and that was Neuralink. And within a couple weeks I had interviewed and decided to join the founding team there, and in a matter of 3 weeks had gone from one plan in one side of the country to my kids enrolled in school in San Francisco. So it was very sudden and a great experience. So.
You mentioned, I think, a lot of the ingredients you find that are common in startups, which is having that desire to see what you're doing. You've seen the need basically in your research, and then a little bit of luck usually, right? And exposure to something. And then just being around people that know how to do it. There is a certain skill set to taking things out and thinking about regulatory aspects and financial aspects and investments and things like that professors actually are not trained in. And so that is one of the things, as you know, we're trying to do in the Knight campus is give our students those skills as part of their educational process while they're getting a PhD. To actually be exposed to entrepreneurship and some of those aspects that they would need to start a company. And that way, if they have the opportunity, they'll have the tools to do it.
And I think it's also needful to be exposed to just that mindset of doing things as a part of a team. And I think in academia, a lot of the incentives are often individual based to a degree that's perhaps more than you often see in industry, and so I think that opportunity to not ask who did it, but what was accomplished, what team did this, and less important the individual credit that went into that question. So I think there's a real potential to shift the way we think about success as well, and that's much larger than Knight campus alone, but really I think academia as a whole faces this existential question of what is success of academia. So,
yeah, you mentioned that you were in physics, and a lot of people sort of thought about pure science not being something that you translated. Mm-hmm. And in my mind, it's not for everybody, but in my mind, it's a misconception that you can only do pure science or translational science, that really one can lead to the other and actually back again. Mm-hmm. And I think that's what we're trying to instill in the culture in the Knight campus. Not every project is going to be translated. Some of them may not have that potential. There may not be a market for it, but some of them will. And then some of those projects will generate new questions that will lead to new basic science and NIH funding.
Yeah, I think so. And I think there's just a virtuous cycle in being open to that and kind of realizing that the way things develop is often surprising. And if we think kind of openly about what's possible in collaboration, so much more happens than we even imagine or anticipate. So, yeah.
I mean, one of the challenges that it's so great to have someone like Tim with us, because he has some experience and I have some experience, and so we know one of the challenges is there's a lot of demands on the time of faculty in an academic setting. You know, you're teaching, you're writing grants and so forth. And so one of the things that the night campus is trying to do is to create that sort of space for faculty to be able to have the time and the energy to pursue these entrepreneurship opportunities. And that's not an easy thing to do.
It's not, yeah, but critical, yeah. And I think, you know, as important as that time and space is just the blessing to do so, to know that this is consistent with one's job description, right? That you're not doing something that's orthogonal to the goals of your organization or your group, but really encouraged to do that. And that's actually very, very significant as well. So, yeah.
Yeah, my own path, you know, I said I started a company as a student. We then sold that company when I became an assistant professor because of what you said. There wasn't really a way for that to be captured as a positive thing as I was going up through tenure as an assistant professor. This was a long time ago, of course. And so, you know, we sold that company, and it wasn't really for another 15 years before I formed another company. And at that point, really the motivation was I didn't want to go through my entire career having brought in millions of dollars in funding, but never actually developed something that made it into a person and improved their lives. And so at that point, I was just really motivated to start thinking not so much about, well, what's the next question I can ask and get funding for, but what is there really a market need for, and how can we use our skills to address that market need? So just a little bit reverse of way academia sometimes thinks about things. So in our case, that was in spine fusion, and my daughter had a problem with her spine that she had to have surgery, and we realized that there were some shortcomings in the medical devices that were used for fusion, and that was a real motivating factor to come up with a solution. And it turned out that there was a business need for that. And one of the questions I get, you probably get this sometimes too, is aren't there conflicts of interest? How, you know, why is this a good thing to be doing in academia? And the reality is you realize a lot of the things we're working on aren't going to benefit people unless you do turn it into a company.
Yeah, I think that's right. You've partnered with a number of people over the years in the starting of these companies, and kind of curious to know how you found those people, and who did you look for in partnerships, and were they people that had, you know, similar technical backgrounds or different experiences?
Usually different technical backgrounds. Most of the companies I've started recently were with another professor out of material science, and so my combination of biomechanics and regenerative medicine, his combination of fundamental material science was really the combination that led to some of those innovations. And you know, a big contributing factor was I was in an ecosystem that helped to support that. And as you know, there's a lot of elements to that ecosystem that the university contributes to. Part of it is, as you say, it being part of your job description. Part of it is, you know, the night campus has incubator space, and there's a lot of data showing that the success rate for startup companies out of academics is much, much higher if there's incubator space right there, so that the faculty can actually balance their time between their startup and their other duties. And just having that experience around. You know, I like the term entrepreneurial judgment. I think it's really important to have that around so you can access that expertise and the people that have done it before. You mentioned that earlier. And of course then there's the whole financing side of it. So you've got to have investors if you're going to do commercialization.
Yeah. I mean, it seems like, in my experience, the process of starting companies, and I'm again involved in another startup that's taking some activity in the lab and seeking to translate that into human neural interfaces. It takes a lot of faith in the process. That, you know, at many points along the way, I can see reasons to stop doing it, right? And so there's something that I think, particularly the demands of time and just level of commitment that academic work involves, and teaching and research and everything, we do outside of that. How do you, and historically, how have you kind of maintained that faith in the process of seeing so frequently reasons to stop going down that path? Because it takes a lot of time and a lot of openness to get through difficult conversations in the beginning, and to to trust that things are going to evolve in a good direction when initially they don't move in that direction. And
it's a great question. I think any entrepreneur that's been successful usually has done several ventures and failed on some of those. So I've done 6 now, and they've had a range of success, from complete crash and burn to a really successful exit, an acquisition by a larger company. So I think you gain from experience, and you learn to recognize when the stars are aligned, and maybe you're going to spend more time on that to really make it go, versus we all know the term, if you're going to fail fast, right? And so you don't put a lot of that effort into it. And so in my case, that company that really failed badly was one that had a very long regulatory pathway, so it was going to be very expensive to get to that point. And then when you started looking at, well, what is the real market need and opportunity relative to that cost and timeline, it just didn't make sense, and so we folded it. So it wasn't that technology was bad, but the other thing I've learned along the way is that you learn to identify these friction points. They might be regulatory, they might be reimbursement. One of the ones I learned along the way is you can develop a great technology that benefits patients, but if the reimbursement is less than what you can actually manufacture it for, that's not a company, right? It's a good technology that maybe in a different world you might commercialize, but you can't, right? So I think learning to understand where those friction points are and investigate them as early on as possible is a good strategy. University of Oregon has actually spun off some really great companies out of the sciences and College of Education, for example, in the past. But it's really been from those a great idea and really motivated founders that's happened. It hasn't necessarily been because there was a infrastructure around it, or as Tim said earlier, surrounded by people that have done it before, and it's just part of the culture. So that's what we're trying to do. In terms of partners, I think a really important one is clinical partners. And so OHSU is very important to us because they have medical school. We recently formed a partnership with Peace Health for the same reason. Locally, those interactions are going to allow our students and our faculty to better understand what are the needs. And now we have a video question from Todd Salnitz at Peace Health.
Hi, I'm Todd Salnitz. I'm the Chief Operating Officer for Peace Health in our Oregon network. And I'm very proud to be here today to express gratitude to the University of Oregon for its spirit of partnership and coming together with us to create this joint venture. This joint venture, just as the name says, is going to help us expand and accelerate the scientific impact on the Knight campus. And we think that's going to happen in several ways. One way is we think it's going to help us really expand our racial diversity. Secondly, we think it's going to help us recruit scientists from communities that are underrepresented in the research field as of today. And third, we think it's going to help us recruit and be available for grants and other funding opportunities that we wouldn't otherwise have access to without this partnership. But we also believe this joint venture is not only going to accelerate scientific impact, but it's going to also help us accelerate the impact to the local medical community and raise the bar there as well. We know in talking with top physicians and others on our medical staff that this research opportunity and getting our medical staff involved is going to help us recruit and retain top physician talent, not only today, but for years to come. And if we keep top doctors and we recruit top doctors, we know that we'll provide better medical care, not only to the local Eugene and Springfield metro area, but the entire Southern Oregon. So we're super excited on what this can lead to us for years to come. And I just finally wanted to thank Bob Goldberg and President Schill from the University of Oregon, and also Peace Health's Chief Executive, Mary Kingston, for coming together over several months to put this together. It's with great gratitude that we see opportunities to partner and really impact our community. Thank you. And yes, I have one of those typical 1 + 1 = 3 questions for you today. What are some of the practical benefits that you might see coming out of this joint venture relationship between Peace Health and the University of Oregon around the Knight campus that might impact one of our community members, practically change their life, have an impact on their life, maybe 1, 5, or 10 years from now? Thank you.
Thanks, Todd. Well, we're so excited about this new venture with Peace Health, which I think is actually the first collaboration between the University of Oregon and Peace Health that's happened. So what can we expect in the next year, in the next 5 and 10 years? The purpose of this program is really twofold. First and foremost, of course, it's to facilitate collaborations between the great science and engineering being done, not just in the Knight campus actually, but across the University of Oregon, and Peace Health practitioners. And that's so important for many reasons. Part of it is just as we're doing science in the labs, sometimes we don't fully understand what the need is. And so having conversations with clinicians, you can better understand what are the actual needs they're having with patients and what are the things that frustrate them. Another opportunity is that at more and more as we're going after funding from the NIH, there need to be collaborations between the clinicians and the scientists. And so I think what we'll see is an increase in funding because of this partnership. The other goal of the program is that we've focused it around postdoctoral fellowships for diverse, underrepresented minorities that are not as represented in the STEM fields. And the reason we did that at the postdoc phase, which is after they finish their PhD but before they go on to an academic career, is there's a lot of data that underrepresented minorities, women, people of color, actually go into the postdocs, but then they tend to turn away to other careers and away from academia. This program is designed to get them experience with clinicians and also to gain confidence that they'll be successful in an academic career. So it'll be a mentored program associated with that. 5 to 10 years from now, I think what we'll see is that because of this partnership, hopefully it will grow substantially. Right now it's relatively modest in size. And I think we'll see a lot of funding. I think we'll see some startup company collaborations between clinicians and UO scientists. One of the strategies, Tim, that we've used with our startup companies is to get a lot of clinicians involved in those companies from the beginning. Because if you don't have clinical champions for the biomedical technologies you're developing, then it has no chance. And so it's really a partnership.